Hello and welcome everyone to today's session of homeopathic management of winter ailments, that is the respiratory ailments. And for today's speaker, we have Dr. Shardul Joshi sir, who is practicing and is a consultant at Prana Homeopathy Yoga Center situated in Pune, and for conducting the various courses on homeopathy, basically focusing on clinical training in homeopathy. We have collaborated with the Other Song International Academy for Advanced Homeopathy, which is located in Mumbai. So, for today's session, I hand over to Sir and request him to please start the session.
Hello and good evening, everybody. So, today we are going to discuss about a very important topic as per our practice is concerned. So, the winter is going on, and this year the winter is really, freezing cold. And here in Pune, this winter is, we are facing the worst winter, one of the worst winter in last decade. So temperature many times going in one digit below 10. So in such kind of cold weather, winter, we see lot of respiratory diseases, lot of respiratory ailments. And these are the what you can say, the major chunk of patient we see in our practice. First is respiratory system, second is GIT system, joints. These are very common system, common diseases we see, and we lot of patient from these systems we see. So if you develop the skill, if you develop the mastery to treat these seasonal ailments, common seasonal ailments like the respiratory ailments in winters, practice can really excel. So today we will discuss about what are the common diseases we see in winters and the common remedies we prescribe for these diseases. We'll try to differentiate between the close coming remedies. We'll try to understand how to take case, how to find out PQRS in such cases. I will show my cases, and through those cases we will discuss and we'll try to understand. So let me share my PowerPoint presentation. So what are the common diseases we see in winter, especially related to respiratory system and joint and skin? These three systems are get affected in winter more. So today we will discuss about the common respiratory diseases. So common cold we know, common cold, coryza, influenza, or we call it as a flu, viral disease caused by the influenza virus, allergic rhinitis, pharyngitis, tonsillitis, bronchitis, asthma, and pneumonia. So these are the commonest respiratory ailments we see in our practice, in our OPD day-to-day practice. So what is the reason why these diseases gets aggravated in winter? So mainly because of the dry weather, cold dry air, and when we inhales the cold dry air, it irritates the nasal passages, it irritates the mucous membranes of nasal passage, of pharynx and lungs also, which will lead to make them more susceptible. The immunity of nasal cavity goes down and it become more prone to catch infection. Then viral spread. So in cold weather, viruses survive longer and they can infect more. So that is also one of the cause. Then indoor pollution. Usually in winter season, we keep the windows, door closed. So because of poor ventilation, the whatever pollutants are there, allergens are there, dust is there, get trapped indoor in our house, and it also irritates the airways. And the most famous, right? You must have seen so many reels about this, the air pollution of India nowadays. Everybody is talking about AQI, air quality index, and which is deteriorating day by day. So in winter, there is lot of dust and pollutants in the air. Air becomes very heavy. So the diseases like allergic rhinitis, asthma gets flare up. So allergic diseases as well as because of irritation of nasal mucous membrane, the infectious diseases also increases. So you see lot of respiratory diseases because of air pollution and dust also. So these are the few common causes. But as we know, homeopathy does not believe in these causes, right? These causes are mere contributing factors or aggravating factors, or we can call them as ailments from. But basic cause is always lies within. So derangement of vital force, we see we have to become susceptible for the cause. So, but how to find out what happened with vital force? So we say we have to take the case of patient, right? And in nutshell, in very short, we will see what we see in any given case, be it acute case, chronic case. What are the major areas you should look for every case? You should look in every case. First of all, you have to try to find out cause in any case. Cause can be emotional, can be mental, can be physical. You have to find, you have to go, you have to ask patient what has happened before you started the symptoms, maybe within that week, within that month, any history of traveling, any history of exposure to cold air, damp air, weight, history of eating outside. You have to keep asking to find out the cause. Maybe sometime patient does not remember, but when you ask, patient can tell you the cause. So cause is very important. ODP, always focus on ODP. How is the onset? Sudden, gradual. How is the progress? Ascending, descending. We have rubrics, we have remedies for these symptoms. Then localization. Where is the localization? Nose, throat, tonsils, pharynx, lungs, trachea. Okay. So as per the localization, we have to develop LSMC, location, sensation, modalities, and concomitant. We have to complete the symptoms. Then altered physical generals, thirst, appetite, sleep, thermal state, any mind symptom, any hyperactivity, irritability, dullness, sleepiness, anxiety, whatever we could observe or patient could observe or relative can share with you with this disease, and at the end examination. So when you see the case of respiratory system in the localization, we have to uh, we have to clearly differentiate between upper respiratory tract infection and lower respiratory tract infection. And as per the URTI, our case could be of LRTI, our case taking question can be changed. Okay. And when we say when there is a affection of upper respiratory tract infection, okay, so rest of the things will remain same. You have to find out the cause, you have to look for the ODP progress, right? You have to see for altered physical generals, mind, mental disposition, everything will remain same. But in localization, when infection is localized in upper respiratory tract, the focus would be more on the nasal discharges. So the upper respiratory tract typically from nose, nasal cavity, nostrils up to the pharynx. Okay. And from there, from larynx downwards, larynx, trachea, bronchial tubes, and lungs all will come in lower respiratory tract. So when the infection is located in upper respiratory tract, then the focus would be more on nasal discharges, sneezing, modalities of sneezing, In nasal discharges, there will be, you have to see for the color, consistency, smell, quantity of discharges, sneezing, nasal obstruction, cough, maybe because of irritation in throat, maybe because of post-nasal discharge, post-nasal drip, pain in nose and throat, modalities of cough, modalities of pain, any symptoms related to eyes, ears. Okay. Then coming to the lower respiratory tract. So in lower respiratory tract, you have to focus the main symptom. Always remember, whenever you get uh, any infection, any disease related to lower respiratory tract, cough and dyspnea, breathlessness would be the two most important symptoms to focus on. You take bronchitis, you take asthma, or somebody is asking about croup. Croup means acute laryngotracheobronchitis or tracheobronchitis is croup. Croup is nothing but in olden days in our repertories they have mentioned about croup, but it is the viral infection, and it is not only tracheobronchitis, but it can extend from larynx also. Laryngotracheobronchitis is croup. So in croup also, if you see, cough would be the main symptom. In asthma also, cough with breathlessness would be the symptom. In bronchitis, cough with expectoration would be the symptom. So lower respiratory tract, cough would be the main symptom, and you have to focus on cough. So in cough, cough is one of the most difficult symptom to treat. One of my teacher, I have seen my teacher saying that if you want to see how your practice is, see how you are treating the cough. If you are treating cough well, that means your practice is going well. Right, you are doing well. So you have to see the character of cough, modalities of cough, concomitant of cough, any expectoration with that. In expectoration, like nasal discharges we saw, you have to see color, consistency, quantity, smell of expectoration, respiration, changes in voice, pain in chest, modalities related to that. So these are the few areas where you could get the characteristic symptom. Yes, I'm just building the background so you can understand how to find out characteristic symptom in these diseases. So we'll start with a case, and this case is of 74 years old male patient, and he developed dry cough since 2 days, and he is having history of chronic bronchitis. So he's patient of known case of chronic bronchitis. But when he that this I got this patient, he has undergone surgery, coronary artery bypass graft, or we call it as a CABG. So he was having a lot of blockages in heart. So they could not perform angioplasty. So they decided to do open heart surgery. So it is called as coronary artery bypass graft. So they did this bypass graft, and he was admitted in hospital. He was in cardiac ICU. And after this surgery, he developed severe cough, severe dry cough, violent cough, and he was coughing. You can see he is 74 years old male. So he's old age, having heart problem, having chronic bronchitis, and developed severe cough. He was coughing so badly, and it is not only cough, but his SpO2, oxygen pressure, was also dropping with cough. So they consulted, he was in hospital, so he was under cardiologist for this his heart surgery. They called a chest physician, pulmonologist, and he saw the patient. He gave some medicine, he gave some anti-allergic medicines to start with, and cough suppressants. So they did not help. Um, so they called him again, then he came, he evaluated again, they gave nebulization, that did not help. He started steroids, to stop the cough, but steroids, the medicines were not helping. And because he has undergone a heart surgery, open heart surgery, the wound was fresh, the drain was there inside the wound, because it's still 2 days to surgery, after surgery. So wound was fresh, the drain was there, the stitches were right fresh, it was very fragile. So the cardiologist was really worried, and pulmonologist was also consulted, nothing helping him, cough was not going down, and with cough his SpO2 was also dropping. So they were really worried. So wife of this patient, she believes in homeopathy, she takes homeopathy, she practice also homeopathy. So she asked the cardiologist, can we try homeopathy? So there was no other option, because no, steroids were also not helping. Cardiologist said, okay, let's try it homeopathy. Wife called me that my husband is having cough since 2 days. 2 days back, he has undergone this surgery, and we are really worried. The cardiologist also worried. What can be done? I said, okay, tell me the symptom, or if he is able to talk, I will talk with him also, and I will suggest the remedy, and we'll see what happens. So he said, when I lie down, on lying down, cough is there. Initially, wife explained all the complaints. And she said, in every winter, he develops this kind of cough. December to January, these 2 months are very bad for him. He has chronic bronchitis and he develops same kind of cough, and it is very troublesome. And now we are more worried because he is in this state. So whenever he lie down, he would develop cough. Whenever he sit, cough will go down. Cough will reduce. So he prefer to sit. And he always says, there is something in my larynx. There is something here which irritates me and triggers the cough. I said, okay, can I talk with him? She said, okay, you talk with him. I will ask to him. So I spoke with him for only 2 3 minutes. He said, yes, I am having cough. He could not talk also very properly. He said, I'm having cough, and whenever I lie down, I feel something here, some irritation, something there in larynx, and I started coughing. And when I sit, I feel better. And when I sit at the edge of the bed, when legs are hanging down, I feel more better. If I sit, I feel better, but I sit like this, I feel more better. I said, okay, what happens when your legs are hanging down? He said, when I my legs are hanging down the bed, I sit like this, straight. So he said, maybe sitting straight gives me more comfort than just sitting. So sitting like this, bending backward, will not give me that relief, but I sit like this, I feel more better. So these are the symptom. Rest, I could not get more history. I with spoke on the phone with him. So what I was having in my hand, dry cough from irritation in larynx. That is what he's saying. Aggravation by lying down, amelioration by sitting up. These are the three symptoms I am having. It was the month of December. Obviously, it was because of cold weather was there, and he is having history of getting bronchitis in December and Jan, cold months, winter season. So that was there in background in my mind. So these are the three symptoms I was having in my hand. Okay. So I started looking for the remedy, which rubric, which symptom we could look into the repertory. We can search into the repertory. So cough getting aggravated by lying down is not very strange for me, because many symptom tells us that when I lie down my cough increases, when I sit I feel better. So this is not very characteristic symptom for cough. But he said sitting up amelioration, then you will say sitting up is also not that rare, right? Usually people tell, people having asthma, people having bronchitis, they tell whenever we lie down the cough get triggered, maybe because of post nasal drip, maybe because of irritation in throat. When we sit, it goes down. But what he's saying, sitting like this, so sitting straight ameliorates the cough. So I thought, let's search this. So I went into the repertory. If you see complete repertory, it is 2017 version. In the cough chapter, cough in sitting amelioration. So cough, sitting amelioration, and you have different postures: sitting bent amelioration, sitting still amelioration, sitting erect amelioration. So this is sitting erect. So what he is saying, sitting erect amelioration, and we have two remedies: antim tart and hyoscyamus. Okay, so when what we know about antim tart hyoscyamus, antim tart is very good remedy for cough, but it is well known for not dry cough. It is well known for when there will be lot of rattling, lot of mucus in trachea. The person will cough with lot of mucus. There will be rattling as if it is the respiratory passages are full with mucus, but nothing will come out. Antim-tart acts very good on pneumogastric nerve. It produces respiratory symptom as well as gastric symptom. So you will see with cough there will be vomiting, post-tussive vomiting, retching and vomiting, coughing, vomiting or retching you will see in antim-tart, and you will see lot of cough in vomiting. So antimatter usually with lot of mucus has to be there. Okay, but the typical symptom is lot of mucus, rattling cough, but very scanty mucus comes out or no mucus comes out. It is very hard to get out. That is antimatter. And what we know about hyoscyamus? Hyoscyamus is very good remedy for dry cough. Usually, when we think about hyoscyamus, what we think? Either fear of being poisoned, or maybe exposing private parts, or maybe fear terror. So these are the fixed images we have about hyoscyamus. But hyoscyamus is very good remedy for dry cough. And when you read Fatak's Materia Medica, what Fatak's write about hyoscyamus? Dry hacking spasmodic cough from a dry spot in larynx at night. Worse, lying, eating, drinking, talking, singing, better sitting up. So in first line, we have all symptoms. We have dry cough, we have irritation in larynx, we have worse by lying down, aggravation by lying down, we have amelioration by sitting up. So all symptoms are getting covered by hyoscyamus. So and the sitting erects also getting covered by hyoscyamus. So I prescribed him hyoscyamus 30. Okay. So I asked her around 11 a.m. we spoke on phone, and I asked her to get hyoscyamus 30, and I asked her to give him hyoscyamus 30 1 hourly. Every hour you have to repeat because it was the emergency situation. So she got the hyoscyamus. It was 2 p.m. in the afternoon. So at the around 2 p.m. she gave first dose of hyoscyamus 30. Okay. And what hyoscyamus 30 did? So next day, it is 7th December. What she says, no cough at all since yesterday 3 p.m. till now. So cough almost stopped within 1 hour. After first dose of hyoscyamus 30, 2 p.m. around he received the dose, and from 3 p.m. there is no cough. Okay. Then next day, it happened on 7th December, 8th December, next day. The cough is 90% gone. Slightly it comes maybe once in an hour, and he got discharged also. So little bit exertion happened after that, but little bit dyspnea is there, but cough completely gone, and he got discharged. So on 6th December, you could see the situation was this. SpO2 was dropping, no medicine was helping. 6th December, this situation, we gave remedy, and on 8th December, very for third day from that, he got discharged. So can you see the if you get the right remedy, you can get the as fast as result like any medicine with homeopathy also. So here what we saw, the exact modality. When we saw the case, when the LRTI is there, he is having bronchitis. So about the cough, character, modalities, concomitant, everything we ask in detail about cough. And this is what we did in this case, and we got the exact modality. Sitting amylation, but that to erect. So this is the difference between, if you have taken sitting amylation, there are so many remedies, but you have to try to characterize it, try to find out more exact symptom. And if you get symptom like this, you could see the results as beautiful as like this. So hyoscyamus dry cough. So there are so many remedies for dry cough. Okay, so hyoscyamus, you could see, this is from Clark's dictionary. If you want to really improve your clinical materia medica, please read Clark's dictionary. I always refer. So, Boric's materia medica, Fatak's materia medica, Clark's dictionary, Allen's keynote. These are four books I usually refer, I usually read if I want to refer something, if I want to differentiate something. So, if you see what Clark says, constant cough when lying down, which ceases on rising up. So this is the hallmark of hyoscyamus, and why I will tell you. The cough is worse at night, after midnight, when at the rest, during sleep, in the cold air, from eating and drinking. Dry spasmodic cough at night, from continuous tickling in the throat, as if the palate or uvula were too long. And this is exact the cause why hyoscyamus develops cough when lying down. So I will show you. So this is hyoscyamus, swollen and elongated uvula. When patient lie down, this swollen uvula irritates the throat and irritates the larynx, and it causes the cough. So this is typical hyoscyamus throat. Okay, you must examine. On examination you will get these kind of symptoms. So this is hyoscyamus. So we have so many other remedies also for dry cough, like Rumex, like Spongia, like Alumina. So here you have the irritation in larynx, so you have remedies like Conime, Causticum, which also have the irritation. Conime also has, Conime is also very good remedy for cough, and Conime also has irritation in larynx. And the typical symptom of Conime is the irritation will be in single spot. So cough originates from single spot of irritation. So in Conime, patient will tell you, doctor, I get irritation, but in single spot. I feel something, some food particle is stuck and it is irritating me, or a small ball of mucus is there, it is not coming. It is not whole throat is irritating, but it is single spot, it conile. And usually the cough gets ameliorated by drinking, maybe by water, maybe cold drink. Same with causticum also. Causticum cupromate also gets ameliorated by drinking cold drink. Causticum is also very good remedy for cough. Cupramate is also very good remedy for cough, but usually they get ameliorated by drinking cold water. Hot water amelioration. Drinking hot water amelioration is spongia. Spongia. Just two days back, I saw a patient. That patient was saying, "Doctor, I drink only warm water, only hot water, and hot water ameliorates the cough." So, and especially in this harsh dry weather, Rumex spongia are the best remedies for cough. And the main symptoms of Rumex and spongia is also again the dry cough, like hyoscyamus, dry hacking cough, very harsh sound of cough. In spongia, you must have read from the books, as if hacksaw, when you cut the wood from hacksaw, that kind of raw hacking cough you get in Rumex, in spongia. But in Rumex is extremely sensitive to cold air. Inhalation of cold air causes the cough, is the Rumex. So Rumex wants to cover. He wants to inhale the warm air. So whenever the Rumex wants covering, Rumex wants ears to be covered, Rumex wants nose and mouth to be covered. So it will give the warmth, and that warmth emulates the Rumex. And Rumex develops a lot of tickling. Rumex is a typical allergic cough of winters. There is tickling irritation in nose, tickling in throat, with lot of dryness in nose, lot of dryness in throat, and cold air aggravation is typical of Rumex. Spongia is also gets aggravated in cold air, cold weather, winter, but spongia is not this much sensitive to cold air like Rumex. Rumex want everything to be covered. Spongia will not demand that covering, but spongia will demand warm drink. So warm drinks ameliorates the cough. Is very typical of spongia, and that cough get aggravated by sweets. Sweets and cold drinks will aggravate the cough. Is spongia and gets ameliorated by warm drink. So you can definitely think of spongia when there is dry cough. Spongia is also having dryness like Rumex, dry nose, dry throat. So dryness with warm drink amelioration, sweet aggravation, you can think of spongia. So spongia is there for dry cough. Rumex is there for dry cough. Hyoscyamus is very good remedy for dry cough. In Drosera also many times you see the same symptoms. Cough getting aggravated when you lie down, right? So Drosera patient also tell you the same symptom, but the Drosera symptom is as soon as head touches the pillow, right? Drosera symptoms usually gets aggravated after midnight. So night aggravation is there, and especially midnight aggravation you get in Drosera. With Drosera, cough will be barking, very violent cough. Usually when you read Drosera, what symptom we get? Cough comes from the abdomen. It is a deep cough. Patient says, डॉक्टर नीचे से the पेट से खांसी आती है, ऊपर से नहीं ऐसे. Constrictive pain, you feel constriction in throat in Drosera, you see spasmodic affection. अंदर से खांसी आती है, comes from abdomen is Drosera. There will be dyspnea in Drosera. There will be maybe mucus will be there, and in Drosera also and vomiting with the cough. But dryness is typically you will see in Rumex and Spongia, okay, and dry cough of Hyoscyamus. Okay, so these are the this is how you have to differentiate the remedies. So we'll see one more case. We saw this Hyoscyamus, and this is how we have to learn actually. I learned this from my case only. So our patient teaches us the remedies. So this is one more case. We'll discuss this case. A 24-year-old male, and he came for his cough complaints of cough and coryza with sneezing since 5 days. So he developed URTI, started with cold. He got exposed to cold air. This case also he came to me in the end of January. In the end of the January, he came and he said since 5 days he's having this cough, and he's a sound engineer. So he works as a DJ, and that he manages the programs, the parties. And usually these parties happens, right? They ends in the late night, right? 4 a.m., 5 a.m. So he has to work very late night, and then he comes home at that time at 4 a.m., 5 a.m., 6 a.m. So usually he said he gets exposed to extremely cold air. So you can imagine how much temperature goes down, drops at that time in the 3, 4, 5 p.m. a.m. in the morning. So he get exposed to that kind of air. And he got exposed to cold air, because repeated exposure to cold air. He's developed sneezing. That sneezing started, cough started, and he developed very violent cough. And that cough was so violent. Because of coughing, he developed lot of chest pain. And he said this cough is so severe that he feel that everything would come out from my chest. He feel my lungs will come out with cough. This much severe cough he developed. That cough was mostly dry, but he was having a scanty expectoration also. Cough would get aggravated by talking, and amelioration by sleeping with covering. So see, this modality is very important. It is not lying down, it is sleeping or lying down with covering. So covering is important here if you see in this modality. Okay. Scanty thick greenish expectoration, pressure at chest with pain in ribs as if bitten. So when he said that, I feel everything will come out from my chest when I cough. So I feel lot of pain in my chest. So what he said, I have to hold my chest while coughing. Like this, I have to hold my chest. I feel lot of pressure at chest with pain in ribs as if bitten while coughing. So this pain in chest, pain in ribs as if bitten while coughing and gets ameliorated when he hold the chest. So when he hold the chest, the pain will less. No change in appetite, thirst. On the examination, I could see the throat was very red, congested, fiery red. So redness, congestion of throat, RS was clear. So I could see there is pharyngitis. So it is an acute pharyngitis, and the main presenting complaint was cough, very severe cough, as if his chest would burst and everything will come out. That kind of severe pain he was having in chest while coughing, in ribs while coughing, and he has to hold the chest for to prevent this pain. So this was the case, right? So what is the natural remedy comes in our mind usually is, so whenever I usually when I give presentation, when I share this case, the answer comes is bryonia. Immediate remedy comes in our mind when we see this kind of description is bryonia, and I was also thinking of bryonia. But what is missing of bryonia? What is not there which says this cannot be bryonia? We have to think twice, be see little, go little deeper, do analysis. So thirst is normal. Usually in bryonia we see lot of dryness of mucous membrane, dryness of throat, tongue, mouth, with increased thirst, with large quantity of water, or maybe desire for cold water. So thirst we see usually in bryonia, which is not there. So I was not very sure about bryonia, so I thought let's do the repertorization. So I went to the repertory. So this was my analysis. URTI, pharyngitis is there. So, and cough is the main complaint we could see. Throat pain was not there, not or very characteristic or prominent. Chest pain was more severe. So I suspected he should not develop the further from pharyngitis to the bronchitis or lower respiratory tract infection. So violent cough is there, pain in chest is there as if bitten. He has to hold the chest, and cough getting aggravated by talking, covering, and we know the cause. Cold weather and exposure to cold, repeated exposure to cold air is the cause in this case. So when I started searching in repertory, so when you go to the repertory, I first go into the chest chapter to see the chest pain. So chest pain, sore, bruised, because he said pain as if bitten. So it is the soreness of the ribs, soreness of the bone. So I thought, let's see the soreness, sore, bruised pain. So pain, sore, bruised in chest. Hold chest with hands during cough. So there are 15 remedies: arnica, bryonia, drosera. So many remedies are there. We know drosera is very good remedy for cough. Bryonia is very good remedy for cough. Phosphorus is very good remedy for cough. Right? We could see many remedies in this rubric. So there is one more rubric. cough, holding body, chest with both hands while coughing. So I thought, let's see this rubric also. So I went into the cough chapter, holding body, chest with both hands while coughing. So here also you can see the same remedies, Bryonia, Arnica, Drosera, same remedies are coming. So I thought, let's put these rubrics in repertory. So I repertorized these rubrics: cough, aggravation by cold air, this holding body, chest, these two symptoms I took, right? These two symptoms, and cough aggravated by cold air. So Bryonia, Phosphorus, Sepia, Natrimur, Simicifuga, Merck, Arnica, Drosera, Borax, Eupatorium, many remedies are coming. But when I saw this, Bryonia is mainly known for stitching pain, stitching, poking pain, especially in chest. They don't have sore, bruised pain or pain as if bitten. So this is not bryonia. Bryonia is stitching pain, and stitching pain gets aggravated when breathing. So it is not this violent movement. A simple deep breathing would also aggravate bryonia. So this intensity is not bryonia, and the kind of the character of pain is also not bryonia. I would be happy to prescribe when I see stitching pain, breathing aggravation, thirst increase. I would definitely think of bryonia. Okay, phosphorus. Phosphorus is known for burning pain, is not known for bony pain or soreness or bruised pain as if beaten. Phosphorus mainly burning in throat, burning in chest, burning in trachea with cough. And usually the cause would be exposure to strong odor, exposure to perfume, scent, strong odor, smoke. This is phosphorus. Phosphorus gets aggravated by smell of flower or perfume, or putting hand in water. So this is typical phosphorus. So when I was looking at the repertorization, I could saw the arnica is there, arnica and eupatorium, and both are from same family, and both are arnica is well known for sore, bruised feeling as if bitten. So I read arnica and I read eupatorium also. So when I was reading the eupatorium, from Boric, I read the Eupatorium. So Eupatorium is usually known for dengue, known for fever with bone pain with chills, right? For respiratory cough, I have never prescribed that time. I had never prescribed Eupatorium. So when I read Eupatorium, hoarseness and cough with soreness in chest must support it. So cough is there, with soreness in chest is there, and for this he has to support it. So I got my symptoms. So I started reading more about eupatorium. So when you read eupatorium, it affects the bronchial mucous membrane, and the main symptom, what Boric says, is bone set, pain in the bone. So bony pain is one of the main symptom in the bold Boric gives in the first introductory paragraph. Bone pain general and severe with soreness you will get in eupatorium. And movement aggravation we know is the eupatorium symptom. When you read more about eupatorium, what Fatak says, leading characteristic is violent aching in bone, breaking pain, as if lung would burst out. This kind of severity you get in eupatorium. Okay, so muscles of chest, back, limbs feels bruised. Okay, and in aggravation you can see worse by cold air. So Fataks write it in capital letters, cold air. When you read further, what Clark says, chilliness predominates, wants to be covered, better in house, worse in open air, worse after being in ice house. So wanted to be covered, and this is what our patient was saying. I want to lie down with cover. So because he was chilly and because of cold air, it was aggravating. He wanted to be covered. He wanted to be get warm. And this is what Clark is also saying. Chilliness is predominant and patient wants to be covered. So I prescribed, after when I saw this, I gave him Eupatorium perforatum 200 TDS. Okay, when I started Eupatorium, he responded beautifully to Eupatorium. Okay. So when I say how was your cough, then he said very rare. It is coming very rarely. it has decreased drastically. Frequency is also gone down, but now little bit cough is little bit expectoration is coming out, right? So I said yes, expectoration is coming is very good sign. Let it come out, but the cough frequency intensity gone down. Okay, so this was in January 4th Feb, because he came to me in the end of Jan. So he said, how your cough? He said cough is almost gone, but now little bit coryza is there. So this is also good sign. Now cough gone almost completely and coryza started. So good sign for us. So I asked him to reduce the repetition of the remedy, and then I stopped. So we could prescribe eupatorium, the so-called remedy known for fever, dengue, bone pain, joint pain, chikungunya. We could prescribe in cough because of the right symptom we chose to repertorize. We read, so it was very easy to prescribe bryonia, because bryonia is coming on the first place in repertory also, but it is not only coming the first remedy, it is matching the symptom, matching with the patient symptom is most important in homeopathy. So symptom similarity is the base, whether remedy is in the first place in repertory or 10th place of repertory doesn't matter. Symptom is very important, and what he was saying exactly written in the materia medica, you could see soreness of the chest and has to support it. This is what patient was telling, and we could give the result. So as I told you, Brina is also having the same symptom. Drosera is also having same symptom. But this kind of bruised feeling, soreness, bony pain as if bitten. He was showing the ribs were paining. So this only you get in Eupatorium or Arnica family. So I did not prescribe Drosera or Bryonia, well-known cough remedies, but Eupatorium. Okay. So when you see cough remedies, so there are so many cough remedies. We get confused between close comings remedy, what to give: calcarea carb, kali carb, ammonium carb, midnight aggravation, night aggravation, lying down aggravation, sitting down, sitting aggravation. So but when you keep prescribing, when you keep seeing patients, slowly your skill increases, and you could see the patient in better light, better symptom, clarity also comes with that. Okay, so still we have 10 minutes, so I think we can discuss one more case. So there are few questions. See, discussing mental symptom, mind is not scope for today's lecture, so we cannot do that. We can meet some other day for that. Uh, for to learn homeopathy, you have to keep, you have to join somebody, you have to go in somebody's OPD, you have to sit with somebody, you have to see how to take case, right? The right way to learn classical homeopathy is to go and sit with somebody and learn in OPD. That is the best form of learning. When somebody takes case, you have to observe the whole case, how the teacher asks up, how to take mind symptom, how to take physical symptom, how he asks LSMC, how he asks leading question. That you learn in OPD. So OPD learning is the best way, is the ultimate way to learn homeopathy and to start homeopathic practice. That is one way. Other way is you can do the different seminar courses. That also one way. But after doing courses, again you have to sit with somebody and you have to get hands-on training in somebody's OPD clinic. Then only you will be ready for practice. So we have so many good courses in at other song academy at Prana for practical learning of homeopathy. And considering this, we are doing the live case workshops in Prana. So we are doing mentoring course also in Prana, where we are showing live cases to the students. So group of student comes and they see live case every Sunday at Prana. So we are doing this offline. And friends, though this lecture is happening online, but I will, let me tell you, offline teaching is the right way to learn homeopathy. These sessions would be just introductory. You have to come, you have to see patient with your eyes, you have to sit in OPD, you have to attend live case, then only you will learn. Okay. So when you have, I could remember one more case. I said I will share one more case. The cold air sensitivity. So I will tell you one case was very interesting, and he was a small boy, 7 8 years old boy, and he was taking treatment for recurrent cough, and he was having cough. He gets episode every 15 days, and he has to get all modern medicine, antibiotics, and the course that the episode will go long, and he will get 8 to 10 days break in between, and again he will get infection again, and he will start coughing, and his cough was very bad. He would keep his parents awake whole night. He would be coughing, vomiting with cough at night. So when he came to me, and this is how we learn the remedies from patient. So I learned this remedy from this patient. He said, father said, mother, father, they were accompanying. He gets cough, especially at night. Night aggravation is there. And with the cough, he gets up. So violent cough. He cough, and he vomits. And when once you vomit out everything, there would be mucus, sometimes there would be ingesta, whatever he has eaten, and everything comes out, and then he feels better, then he sleeps. And he gets the cough by slightest exposure to cold air. He cannot bear cold air. Cold air coming through a slightest gap from the window, he would develop cough. So we have to protect him, keep the warm cloth, keep him always covering. We cannot do always, right? Somewhere he goes out and he gets exposure and he develops coughs. So when I listen description, what is more important? Sensitive to coldness, sensitive to cold air is cause, is one of the main symptom from where it triggers. Second is cough aggravated at night, and third is he coughs and he vomits. So post tussive vomiting is there, and after vomiting he feels better. So when you go to the repertory, so I will share my repertory with you. When you go to the repertory, go to the complete repertory, go to the cough chapter, go to, no, not cough chapter, go to the stomach chapter, go to the vomiting. And in vomiting, you see cough. And here is one rubric: stomach, vomiting, cough, ending in. So cough and ending in vomiting. So whenever there is vomiting, cough would end there. So whenever he had vomiting, his cough would stop. So single remedy is there, meserium. So meserium is not cough remedy. I was knowing meserium one for neuralgia, right? Herpetic neuralgia, post-herpetic neuralgia, and second for skin eruption, crust on the scalp, and we used to mug up in the college. But here, cough ending in vomiting, meserium is there. And when you go and when you read meserium, when I read meserium, I was so shocked. When you see Boric, okay, Boric writes pains of various kinds with chilliness and sensitiveness to cold air. Patient is very sensitive to cold air. Everywhere boric Phatak you read, everybody has emphasized that sensitivity to cold air. And he was very cold air. And we know that meserium has night aggravation. So worse night in bold, Phatak writes. Worse night by cold air, by drafts. Patient is very sensitive to cold air, cold draft. And cough ending in vomiting. So I prescribed him meserium, and he responded so beautifully to meserium. And his parents were so worried, they were so tense because of his recurrent URTI, coughing, vomiting, not getting better, repeated attacks he was having, school absenteeism, his health was not, he was not thriving, so many problems with that. And the only single remedy meserium solved this problem. They were so happy, that child was so happy. So meserium, I learned meserium from that child. He taught me meserium. So these are the experiences. So when you see patient, when you differentiate, when you give, when you read, then you develop your own experience, then you develop your own skills. So still we have so many, it is 1 hour is very less time to cover whole respiratory ailments, but I tried to discuss the cases of cough usually we get in cold weather, and the differential remedies which I know that came offhand in my mind. So hacking dry cough, usually what I have seen, hacking dry cough is usually we see in allergic complaints. The respiratory allergies get triggered after Diwali in India. From October, November, December, you see lot of allergic coughs, and allergic coughs are usually dry and hacking, very less expectoration. What I have seen, infective diseases, infective coughs are productive. In bronchitis, you will see a lot of expectoration and rattling. Or if there is LRTI, you will see cough with fever and lot of mucus and expectoration. But in allergic coughs, you will see dry cough for long duration and there will be no fever. So these will be the usually typical allergic cough, and those cough will be very dry hacking. And usually dry hacking cough, patient is not going to come and tell you that patient, doctor, I am having hacking dry cough. When you listen, you have to listen. It is the dry, very dry cough coming from the throat. There is no mucus, because when there is mucus, you could see lot of rattling, lot of the wet voice of cough. So patient in patient's language is not going to, he will just tell you, doctor, there is no cough, there is no phlegm, there is nothing coming out. There is no mucus in my throat. When I cough, there is no mucus. That much patient can tell you. But either you have to talk with relative or attendant or friend or accompanied person will tell you. When we hear the sound of cough, it would be very dry, it would be very harsh, it would be very hacking dry cough. So that it is not the language can define this, it is the sound you have to identify in the dry hacking cough, and usually in allergic. And as I told you, Rumex, spongia, bromium is also very good remedy. Bromium, spongia has the content of bromium, right? Because sponge, we get the spongia remedy from sea sponge, and bromium is one of the main chemical content of that. So in bromium also you see the same kind of dark, harsh dry hacking cough, but the difference is bromium gets aggravated by warmth. Bromium get aggravated by warm drink, warm food, and spongia get emulated by warm. This is the basic difference between bromium and spongia, though they look very similar. Okay. So I think we have come to the end of today's session. It's already 5. So for learning opportunities, we were discussing. So we are doing, somebody was asking how to learn the homeopathy. So we are doing this workshop, 2 days offline workshop here in Prana in Pune. So this Prana Homeopathy Yoga Center is situated in Pune, Maharashtra. And we are doing this 2 days offline workshop where we are going to teach how to treat thyroid diseases and how to treat acid peptic disorders. So here in Prana, we do specialty homeopathy. My colleague, Dr. Gitesh Kalyankar, he looks after the thyroid OPD, endocrine diseases. So on 11 Jan, so day after tomorrow, he is going to talk about on the treating thyroid disorder, and he is going to take one live case in front of all students. So you can experience the live case, how to take live, how to take case in thyroid diseases. And he will teach the common remedies, he will teach the differentiation between close coming remedies of thyroid disorders. And on 18th Jan, the next Sunday, I am going to talk about the acid peptic diseases. So gastritis, chronic gastritis, gastric peptic ulcers, GERD, acid acid reflux, hiatus hernia. So all upper GI disorders I'm going to talk, and I'm going to also take one live case in this workshop. So you will able to see a session on these diseases and one live case. I'm going to take a case of acid peptic disorder. So it will be a complete package of learning. So 2 Sundays it is there, consecutive Sundays, 11th and 18th January. So you can take advantage of this. You can see the fee also is very minimum. We have kept very minimum fee too, so student can also attend. So don't miss this opportunity. Come for this workshop also. And as I told you, online is just trailer. If you want to really learn homeopathy, offline is the only way to come and learn and improve the skills of homeopathy. So this is also one request I want to do. Every homeopathic student, doctor who is listening this video, this session, please come and attend, and please uh, try to learn from somebody. Guru is very essential to learn homeopathy. So go to somebody, sit with somebody, sit in somebody's OPD, start seeing your patient, then only you will improve your skill. So thank you. This is for today. Dr. Karishma, if you want to add something, you can add.
Thank you so much, sir, for today's session. The chat section has also been very interactive, and if some of the questions have been unanswered, please keep commenting in the below the videos. We will get it answered and reply to your questions. And I hope to see everyone also on Sunday, that is 11th Jan. Thank you so much, sir.
Okay, thank you.